As an alternative to sugar, artificial sweeteners are used by millions of Americans. According to Statista, 141.18 million Americans used sugar substitutes in 2021 alone. Because artificial sweeteners have no or very few calories, they're often added to foods and drinks with the idea that they'll help with weight loss. Additionally, they are used in toothpaste, gum, and candy to add sweetness without risking tooth decay. According to a new study, they may be associated with increased cancer risk. Hey everyone, welcome to Health Informer. What are artificial sweeteners? Do artificial sweeteners cause cancer? What kind of cancer is caused by artificial sweeteners? Should you stop consuming artificial sweeteners? In this video, we are going to answer all these questions. So, let's get started. What are artificial sweeteners? Since artificial sweeteners are calorie-free or very low in calories, they are added to many foods and drinks with the idea that they will help weight loss. They are also used in toothpaste, candy, and gum to make them sweeter without causing tooth decay. A large cohort study of more than 100,000 French adults suggests that artificial sweeteners may not be as beneficial as we think they are. Charlotte Debras, Mathilde Touvier, and their colleagues from the French National Institute for Health and Medical Research and Sorbonne Paris Nord University discovered a link between artificial sweeteners and an increased risk of cancer in this study. The link between artificial sweeteners and cancer. Researchers decided to investigate the possibility that artificial sweeteners cause cancer since artificial sweeteners have long been a subject of debate. A total of 102,865 French adults participated in the NutriNet study. In 2009, the Nutritional Epidemiology research team began an ongoing, web-based cohort study. A voluntary survey is being conducted with people reporting their medical history as well as socio-demographic, diet, lifestyle, and health details. Using the 24-hour dietary records of the participants, the intake of artificial sweeteners was determined. Researchers analyzed information about cancer diagnosis to determine if there was any link between artificial sweetener intake and cancer risk during follow-up. Age, gender, education, physical activity, smoking, height, weight gain, diabetes, and family history of cancer were all adjusted for in the study. Several factors were also taken into account, such as energy intake, alcohol consumption, sodium intake, saturated fat intake, fiber, sugar, whole grain, and dairy consumption. Are you enjoying this video? If yes, hit the like button. It is greatly appreciated. Artificial sweeteners are associated with increased cancer risk. Health experts suggest that the regular intake of artificial sweeteners may be associated with increased cancer risk. According to observational studies, these two variables have previously been linked. Moreover, studies have suggested that artificial sweeteners may cause cancer. Nevertheless, their study is one of the first to examine the association between artificial sweetener intake and cancer risk in addition to taking into account the different kinds of sweeteners. What kind of cancer is caused by artificial sweeteners? According to their study, aspartame and acesulfame may increase cancer risk in humans. Furthermore, they noted an increase in breast cancer risks in cancers linked to obesity, such as breast, colorectal, and prostate cancers. Should you stop consuming artificial sweeteners? In light of this study, how does it affect consumers? Should we stop buying artificially sweetened foods? Dr. Mary John Luddy, Professor of Food and Nutrition and Chair of the Department of Public and Allied Health at Bowling Green State University, cautioned that correlation does not equal causation. In an observational study, it is not possible to determine whether the consumption of very high levels of artificial sweeteners is linked to cancer or whether cancer patients consume excessive amounts of artificial sweeteners, Luddy said. Experimental studies are required to establish cause and effect. Similar concerns were raised by Dr. Andrew Odegaard, Associate Professor of Epidemiology and Biostatistics at the University of California, Irvine Program in Public Health, who was not involved in the study. According to him, certain types of biases are inherent in these types of studies, so it is impossible. Here are some healthy sweet tooth suggestions. According to Luddy, there is no consensus on which artificial sweeteners are the safest to use, but she suggests trying to consume these products in moderation and focusing on their overall nutritional value. Her recommendation is to prioritize foods like vegetables, fruits, and dairy to maintain a healthy sugar intake. Natural sugars are present in these foods as well as vitamins, minerals, and fibers. Further, she suggests limiting the addition of sugar to food during the preparation and processing processes. According to Luddy, one should consume less than 10% of their total calories from added sugars. The person eating a 2,000-calorie diet would consume no more than 200 calories or 50 grams of sugar. Luddy recommends drinking plain milk or water instead of sweetened beverages and eating sweetened snacks and desserts in moderation. Last but not least, she recommends comparing labels when grocery shopping. Check the added sugars on the Nutrition Facts panel, suggested Luddy. By choosing products with low amounts, you can make healthier choices. The experts suggest limiting foods that contain sugar or artificial sweeteners. I hope you found this video useful and informative. Please like this video and be sure to subscribe, because more incredible health content is on the way.